better than iron. It does more than any other mineral. Zinc is the king in the mineral family. You must keep your zinc up. You must make sure you have a good level of zinc, and it would do good for every person in this room to buy a bottle of zinc and go through about 2 a day through the whole bottle. Once a year you should do this. Some people may need at least 1 zinc or 2 zinc for the rest of their life, and when you start to see some of the reasons, then you'll understand why. Zinc starts out as being a control of a catalyst in an enzyme chain. They have now identified 75 different enzymes that can't even be made without zinc. Zinc is a major controller of the starting process for digestion and assimilation. Then they found that zinc is a controller for the beginning of life. Zinc is a controller of fertility. They have found that at the time of the month when the lady lets the egg come down through, that if a man's sperm does not have enough zinc, it cannot penetrate the egg, has not the possibility of penetrating the egg. But if a man has enough zinc, the sperm will have the power to penetrate the egg, and you can have fertility every time based on zinc. It's the controller for fertility. I was privileged, and Carol and I were privileged, to be sent to New Zealand and meet the man that did the first work on zinc. The first study ever done on zinc was done in New Zealand, and they did this study. It was an interesting study, by the way. They did it on the rams that live clear up in the high mountain glacier area. And these rams have an interesting habit, and they were studying them very closely. And they found out that these New Zealand rams living way up there would gather up a harem of about 200 does, but could only take care of 140. Now, I don't know why they gathered up 200. But in the process, they found that if these rams tried to take care of more than the 140, that their hoofs would rot off and they couldn't walk anymore. Serves them right. Anyway, in the study, they gave these rams, zinc therapy. And they found out that these rams with zinc therapy could take care of all 200 and not lose their hoofs. Very interesting story. Now, the moral to that story is ladies, tonight, check your husband's toenails. It does, by the way, help your nails. If any of you have brittle nails or bending nails or lines down your nails or soft nails or little white floaters coming up through your nails, all those are zinc. You add zinc and you'll be shocked at the benefit to your fingernails and toenails. If you have funguses growing, yellow funguses, blue funguses, green funguses growing in the toenails and such, you get the zinc up and the environment changes and the funguses leave the nail area and the nails get strong and healthy. And so actually your nails are just the same as hoofs, and so it'll help a lot. But then the zinc moves on into other important areas. For example, they control growth. There's a time when a lady needs more zinc than a man. A man needs 25 milligrams of zinc every day for his prostate alone versus some of the other needs too. But a lady, there's one time when a lady needs more zinc than the man for the prostate, and that's during the time of nursing a newborn child. Nursing a newborn child, a lady needs 35 milligrams of zinc a day for nursing. And they have found that zinc is the controller for growth. And if a child is deprived of zinc during prenatal care and during the time of nursing, that the child will not be able to attain its full stature of growth, even though its genetic structure was set a certain way. If a child is deprived of zinc at this right proper time, the child will not grow tall enough. It'll be shorter than it should have been. Its arms will be stunted. It can have abnormal head size. It can have all sorts of problems, all because of zinc at the wrong time or right time. You need to make sure that the children have zinc, and all pregnant ladies and all nursing mothers need to make sure you're into your zinc for the potential growth of that child. The zinc then controls even maturity. The maturity of a young lady coming into her monthly cycle. If there's not enough zinc there, it can delay it on into even ages older, like 17 or such. And then when the monthly cycle comes, it can be full of cramps and pains and hormone adjustments off and psychological attitude and a disrespect for femininity, a misunderstanding of femininity, all because of the loss of zinc. You get the proper amount of zinc in there, and the monthly cycle comes at the right time. So easy, such a natural, normal flow, and such acceptance. It's wonderful. Same with a young man. If a young man doesn't have a right amount of zinc at the time of puberty, it can stall him off into an older time and give him a psychological damage towards masculinity and improper attitudes towards sexuality. And you'll find several problems can come right in that area without enough zinc. You need to become mature when you're supposed to become mature, and that's the natural system, the way it's supposed to work, and zinc is the controller at that proper time. You must get your zinc up. Zinc is the controller of healing. It's the #1 healer. It's even a better healer than the famous connective tissue of vitamin C. Zinc is the greatest healer. Our famous Dr. Arthur First proved that to himself one time, and he was very privileged to share with us. He had hurt his back at about age 76. He does Greek dancing. He'll jump higher than that table and come down on one foot. It's amazing what that guy can do. He was in the Olympics, by the way, when he was a young man. Just incredible man. And he had hurt his back, and so the doctor said he needed a little quick surgery in the back for the nerve pinching. And, of course, at Stanford University, where he's so well received, they had the specialist surgeon, and they have some of the best surgeons in the world there at the medical school at Stanford University. And so the very, very best surgeon he could find at Stanford was going to do his surgery, who had done thousands and thousands of surgeries. He was a very, very high-quality surgeon. And Dr. First took a high therapy of zinc. Now, zinc can get toxic, so you shouldn't take a high therapy of zinc more than 2 weeks. Then you should stay at a normal potency for the rest of your life. You should not take a high therapy zinc because it can be toxic. But he took high therapy on zinc for 7 days before the surgery and up to 10 days after the surgery. And when he went back for his exam after the surgery and the doctor looked at the incision and the cut, it healed so fine it was almost like a plastic surgeon had done the job. The surgeon said he didn't think he'd even done that good of a job himself, and the surgeon said that that was the best healing of any surgery he had ever seen in his entire career. And it was all because of the high-potency zinc therapy that Dr. First used for the healing process. And it is the best healer you can find. And if anybody has sores, little ulcers that won't heal, little burn lesions that you have, or in the mouth, or you even find acne for pimples for adolescents, if they have lots of acne, zinc will dry up the acne, dry up the sores. It's absolutely wonderful. And then zinc is also the controller of degeneration of muscles. You find that when older men get quite old, their legs get a little skinny. Have you seen older men, their legs get little skinny legs? Well, their zinc is gone. And so you need to build the zinc up. You got to stay on the zinc all your life. And if a man gets older and has lost his zinc and his legs start to get skinny, he can then walk and walk and walk. And when he gets where he's going, he's wasted, and he has to sit down. He's in the way, and they don't give him any respect at all. But men, if your legs are strong, you can walk and walk and walk. And when you finally got where you're going, you still play with the grandkids, and you lead the family. You give them advice. That's called a loan. And you work around. You help the whole family, and you're physically strong, and you want to be strong all your life. Men, how many want to be all there when you get there? You want to be all right. Then zinc, zinc, zinc. Our zinc is chelated. We take amino acids and we bond it. We chelate it. And you know, most all minerals have a negative and positive ion, which causes a magnetic charge, and it sticks to the lining. The majority of all minerals magnetize the intestinal lining, and as you eat the next meal and the next meal and the next meal, it brushes it and brooms it and pushes it forward. And most minerals get pushed right out through the elimination channel. There's a lot of protection to the intestinal lining. For example, calcium is the #1 protector of cancer in the colon because of its benefit of sticking to the lining of the colon and preventing cancer there. But it shows also that the calcium magnetizes, and other minerals magnetize and stick to the lining of the intestine and colon and don't get in very well. So you have low bioavailability of most of these other sources. Because we bond the amino acids to it, and we're the creators of double amino acid chelate, we've created many of the technologies that are used in the world today. We're the creators of double amino acid chelate. Putting the 2 amino acids on it, it negates the negative and positive charge, and it lets it go through the villi in the intestinal tract and passes through the lymph fluid, which is another barrier of control, and it passes through the lymph channel finally to the bloodstream, and it delivers it clear to the bloodstream. Now your blood amino acids pull these amino acid chelators off of the mineral and deliver the mineral to the proper side of your metabolism, and we deliver the highest bioavailable zinc in the world today. Yes. Calcium's another wonderful story. Ladies have to worry about several reasons for calcium besides osteoporosis. We'll just talk on osteoporosis, but there are many other needs for calcium.